Hi, my name's Michaela,
And I'm Kira.
and welcome to Let's Ace It podcast.
Today we're going to be talking about our Block 3.
Oh, goodness, our Block 3 just started, and it has been quite a hectic week, but thank
Already? Oh
you.
my gosh.
Thank you for tuning in. I know that we were down last week because we
Again,
had
it's been hectic.
it has been hectic, but we're trying to get caught up, and so yeah, let's just get into it.
Thanks for sticking with us. I know
Yes.
I was just telling Michaela, I was like, no talking before the podcast starts because we need to save all of it for the podcast.
There is so much to talk about. Like all of our previous podcasts kind of have built up to like talking about everything that just happened within this first week. Literally everything.
I know. So excuse us if we chit chat a little because, whoa, it's been 4 days and I feel like I've been in this rotation for like 2 weeks already.
Literally. So you like show up on your first day. Tell me about your first day. Obviously, last week we kind of went over business casual a little bit.
Yeah.
So like tell me how your outfit went, everything in
Oh,
your appy bag, and just like
everything combined, huh?
everything combined.
Okay, let's talk about my outfit. What did I wear? I wore all black just to play it safe, like I said, because I
Exactly.
wasn't really sure the vibe because it was like a community care rotation, so not really too sure. And then in my appy bag, I pretty much brought like everything that I would bring to the hospital to this rotation. Let me just say I struggled finding my organization during the first few days. So I ended up taking out a lot of things from my appy bag. And then what was the last question? Hmm. Yeah, that was pretty much it. And how about you? Because it's
Yeah,
a whole different like place now.
literally, yeah. So, like, going and finding the place initially was the biggest hump that I had to like overcome. But while I was getting out of my car, I ran into a P3, and she had been going and like doing her rotation in the central pharmacy. And so she kind of like walked me in and kind of showed me like the different elevators and everything. And very much took away a lot of my anxiety and got me like to my area that I needed to go through for the day.
Oh,
And
thank goodness.
yeah, that made it very much a lot better.
Yeah,
But
that's like the horror about starting at a new place is parking and driving situation. That's
exactly.
stressful.
Yeah, the like week before I had did a dry run because I have anxiety and I need to know like how long is it going to take me to get there? How long is it going to take me to like walk to the building and do all of that? And so I got that dry run, so I knew I was prepared, knew where I was going to park and everything.
Oh my
But I
gosh.
definitely think that preparation was necessary.
Yeah. And then outfit and bag.
Yeah, for my outfit, I wore one of my new pairs of Carhartt scrubs
Stop it.
that Kira influenced me to get last week. They're great, they're adorable. I got the flare bottom ones,
Cute.
like the straight leg. I'm not a big fan of the jogger ones. I think they look funny on me.
Agreed. And like it's not the style anymore.
I don't know. I mean, like, it looks good on some people. I see them in the hospital and I'm like, wow, I wish I could pull these off, but I don't think that I do. But yeah, that's
Uh,
what I wore.
an appy bag.
So in my appy bag, I had my folder. So my folder has my pharmacy license in it, my immunization certificate, my CPR, and then also just like a couple little extra note things, like the
Well,
syllabus and stuff that I printed out beforehand.
Was that folder
And
requested by your preceptor, or that's just you being type A?
that's being type A, and then also you telling me about how you had everything prepared. So I prepared all of that like 3 days before the rotations.
Well, our advisor sends them all.
Really? They have our
Yeah,
licenses?
because when we like send it, you know how we upload it on Canvas?
Oh, wow.
Yeah.
Wow, I had no clue. Interesting. Um, so I had my folder. I had a notebook that I just take notes in. Pretty much used it as a to-do list. And then I brought my iPad, and yeah, it was pretty much just an orientation day. So
Yeah.
yeah,
Can we talk about the transition from one block to another? How it's literally just a weekend?
it is so jarring.
I know.
Like,
Like you get to know these people for 3 months, and if you're there for 2 blocks,
it's such a jarring experience, especially going from like different types of pharmacy to other types. You have a weekend to prepare the materials. I had no time.
and like your last week of your previous rotation, that's when all your final projects are due, all of like the things that your longitudinal like projects, journals that you've been keeping are due. And then it just ends. And then you kind of have to change your mindset. You got one weekend to kind of like poof, take that all in and then like switch gears in your head and move on to this new type of pharmacy or new rotation. It
Yeah.
is just insane.
Yeah, I'm just so mind blown. I went from a business administration rotation where I didn't say lisinopril or gabapentin for 6 weeks.
That's
It
insane.
didn't come out of my mouth one time.
Yeah. I
And
mean, you've
not
done this 3 times already, like where you just switched to a different place.
yeah, I did kind of, I mean, during the specialty rotation, you kind of, it's a big picture of all of their medications. But I'm actually excited that I'm going into hospital right now because I really do need to know hospital medications. Like, I
So
can't
this is a
just.
transplant hospital. Is it kind of like a normal hospital setting? What's the difference?
So, we're actually just in a unit, and the pharmacist shares a room with a whole bunch of like medical
Well,
students, and it's a very cramped space. So the feels like the pharmacist kind of has like a little makeshift desk in there, and then there's three transplant pharmacists, I think, and one of them stays in that room, and then one of them has like a desk kind of in the corner of the unit. But it's probably like 20 rooms, maybe,
wow.
but they're not all full. I mean,
Well, the
I think we had like 9 patients on our list.
oh
Yeah, because I mean, not everybody's getting a transplant.
yeah,
But it's
but
just kidney and liver.
so do you still monitor all the patients on that floor, or just patients that are getting those transplants?
Yeah, so just the patients in our unit. But
Oh,
then there's
okay.
also there's patients in our unit, and then there's also patients at the children's hospital, and then also patients at the VA.
Oh, and you're monitoring all of those patients.
Yeah, but still we
Oh,
only
okay.
have like I think 10 to 12. But it's still kind of a lot cuz you're
So
trying
10
to
to
not
12 patients for 8 hours.
yeah, but you're trying to not let their organs reject. And a lot of them are on some of them are patients that just got transplants, and some of them are patients that are coming back because their organs rejecting.
Okay. I don't know why in my head I'm like, okay, you also see patients like outpatient monitoring kind of stuff.
Oh no,
No,
that's what
just
the
people in the hospital.
yeah, that's what the like nephrologist does. So
I
yeah, so this is just pretty much inpatient care, taking care of the organ for like the first like 3-ish months until everything gets transferred to their nephrologist.
stop. This is so interesting. You get all of the interesting rotations. Like you see all of the medications that we see in probably like one lecture in school.
Exactly. I'm like, thank you for teaching me what tacrolimus does and its
No,
side
seriously.
effects.
because we got what like lecture during our last 6 weeks of school, and I
Yeah.
still can't remember the side effects. I can't remember this.
No, but it causes it. So actually, tacrolimus can be harmful to the kidneys. Um, so that's a thing, and it
So
can
does
cause
it have a
hypertension and
narrow
headaches.
narrow
As a
therapeutic window then?
Yeah, it has trough
Oh,
goals. We do monitoring. Yeah, yeah.
interesting. Oh my gosh. So tell me about a day, like a typical day.
So my first day was orientation. Second day, I was in the OR and I watched a transplant. And
What?
me just trying to casually, oh,
Like
I
slip that in?
watched a transplant.
Like
Um, s-
literacy, same blood.
yeah. So I watched it was a living donor transplant, and I watched the kidney removed, and then I also watched that kidney be put into the recipient. So
That's
that was an
amazing.
entire day in the OR. That's not a normal day. I don't. That's not normal.
So
That
did
was
you have
just
to
the
do like a
opportunity.
scrub, like a full scrub in?
Yep.
That's so fun.
Yeah.
Living my Grey's Anatomy dreams.
But a normal day, so I'll show up, I'll load up the patients, I'll look at them, I'll look at their labs. There's a kidney like order set. So on post op day 0, post op day 1, 2, 3, they're on different types of medications. So for the specific days, we're monitoring those medications. Monitoring their renal function is really important because they're getting a new kidney, or monitoring their liver function if they're getting a new
Yeah.
liver. And then we'll do some rounding with the transplant team. The transplant team will be medical residents, fellows, the physician, and then the pharmacist will join in as well. And then we'll go and see the patient, kind of get an update about what's going on, and update them about changes in their care. And then after we do rounding, we'll pretty much go into the rooms, because patients that are getting discharged, we have to teach them how to use their medications. And so we'll go do some teaches and we'll give them their medications. And yeah, that really feels like the day.
Wow.
What's
That
your
is
day?
like, oh my gosh. Okay, so I am now at a kind of a hybrid rotation. It's community slash ambulatory. So it's all combined in one little pharmacy. And these pharmacists, they are clinical pharmacists, so they still are working with providers and looking at patients' medical charts and stuff like that. But they're still running a retail pharmacy. Like they have two hats the whole day, and it just seems so intense. Yeah. And my day, I'm on my orientation week. So what I've been doing are reading like BCACPs on like cardiology and diabetes. And that's because in this rotation, I'm going to be seeing my own patients and conducting like hypertension, like med review checks, so I can start, stop, and initiate meds. And even for diabetes, I can do that. So I have to kind of pass off on all of these disease state topics before I can see patients. So that's what I've been working on this whole week. And then already, like on that, like I'm already creating like a referral list, meaning I've been looking at patients' epic charts to see if they've been diagnosed with hypertension or diabetes, and see like when their last blood pressure or A1C was checked. And then next week I have to call all of these patients to set up appointments. Like it's like I am like a physician, like, or a provider all in one, like doing everything, like setting up their appointments, doing the appointments, doing the chart notes, and like making the medication review checks.
Bro. Oh my
Yes,
gosh. Do you love
I
this?
I am in love with this. Like this is like what I like want to do with my pharmacy career, I think.
Really? Okay.
Yeah,
So,
because
like, compared to hospital. So, like,
it's
what's the.
I wouldn't say it's a lot more difficult than hospital, because like hospital, like yes, you're reviewing all of like the labs and you have still a lot of autonomy on like medication recommendations. However, at this point, like they have collaborative practice agreements. So we as pharmacists have the ability to like prescribe a lot more. And like I think every retail pharmacy should have Epic. Like after my 4 days of being here, because literally this one patient, we didn't have the medication and we're like it was canceled, and they looked at Epic and they're like, oh yeah, it was sent to Walgreens. I'm like, you wouldn't have known that like at a regular retail pharmacy.
Yeah.
And then two, like this other guy, he ran out of insulin because he was using it more than he was like prescribed to, and the pharmacist was like, "Oh, let me just write you a prescription right now," and like we literally had it ready for him in 30 minutes.
Yeah. That's that's so crazy. That's
It's like
I
a game
also love that.
changer.
Yeah.
Yes, and it's just like wow, like just observing this. I'm like, this is how every pharmacy should be run, because then everyone would have such a better pharmacy experience.
But the thing is with that is it would require all pharmacists to have a residency.
No, not there's two pharmacists there that don't have residencies.
Are they
But
covered
the
under the collaborative practice agreement?
so what happened was I guess in order to be considered for clinical pharmacist, you have to have 5 years of experience. Yeah. So that's what it like there's two routes to becoming a clinical pharmacist. Like either I guess there's a lot of avenues to become a clinical pharmacist, but like one is going through residency, the second one is like getting 5 years of experience, or you can have 2 to 3 years of experience, but you need a certificate. Yeah.
Wow.
So
The more you learn.
yeah, but to say that my head is gonna explode is kind of crazy, because I just don't know how these pharmacists handle like the pharmacy manager there. She's like the jack of all trades. I like watch her and I just don't know how she handles her day, because she was precepting me, doing pre-ver and verification, still chat like doing becoming a clinical pharmacist and chatting with all providers to answer all of their questions,
Hmm.
seeing patients for blood pressure checks, being put away for consults, and she's also the manager, so she goes to provider meetings daily,
Wow.
all in the 8 hour day. And I am like, how is she getting this job done? Like, it's insane. But I'm really excited to spend the next 2 blocks here.
Wow, two blocks back to back. So are they going to be like the same stuff or does anything like change? Like
Um,
preceptors change or anything?
so apparently my preceptors are supposed to change, but I think it's gonna stay pretty fluid throughout the whole thing.
Because that's what like my back to back ambulatory care rotations, they're at the same place, but I have two different preceptors, it says on my
Yeah,
thing.
I think that's how it has to be in our value, but I think it ends up being dependent on your site. Yeah,
But it's been pretty good. I mean, I'm working a good shift, 7 to 3:30 right now.
yeah.
The problem is the traffic. So you'd think that 3:30 would beat the traffic, but no.
No, that's the start.
That's the start of the traffic. So you may be off at 3:30, but you don't get home until like
Ugh.
4:45.
And what's the commute like? 40 minutes?
There when I get there, it's only like a 23-minute drive there because I miss all the traffic. But the miles are like 13 miles. It's not even that
Yeah.
far.
Oh my god.
But
Yeah. What is? No, sorry. Go ahead. I forgot what I was saying.
yeah, I do need to figure out a situation. The one of the big things with certain hospitals is parking, and they don't provide a lot of parking options for students or for staff, because they really do encourage you to commute or use different types of transit systems. So I'm currently still in progress of determining what transit system or what I want to use to get to campus.
So, have you used a different transit center every day that you've gone?
Nope. I
Just your
paid for
car.
parking.
Oh my gosh. And I just know where you're at. That's like $300 a month.
Yeah. So we'll see. Maybe next week I'll have to test it out and kind of see. But that is so far what's going on with our third rotations. I mean, just kind of
Yeah.
stepping into something new.
I think it's exciting for both of us because I think that like we finally get to use our clinical brain the way we want to. So, oh my gosh, there's gonna be a lot to spill in the next couple of weeks.
So, do you have some journal clubs planned? Patient
Oh my
case
gosh.
presentations?
We went over my project schedule today. Why do I already have a topic discussion next week?
Mine's
Tuesday.
tomorrow.
Oh my gosh. I cannot imagine. Imagine having like, oh, 3 days there. Oh, by the way, you have a project due on Friday.
So, go over for everybody what a topic discussion is. Let's kind of talk about all three: topic
Okay.
discussion, journal club, and patient case presentation.
Yeah. So a topic discussion is basically like going over a disease state and kind of how you treat that. And for pharmacists or pharmacy students, our focus is on medication and the advantages between drug classes and stuff like that. So that's basically what a topic discussion is. What's your first project on?
Mine is on transplant immunology.
Wow. And is it a journal club or a topic discussion?
It's a topic discuss. Transplant immunology is about the immune system. So T
Girl,
cells,
what?
B cells,
Girl, bye. I
all the stuff
maybe
that was the worst in pharmacy school is my
yeah,
first
the
topic.
everything that we zoned out.
But yeah,
Okay, so
I'm glad
maybe
that I'm
next,
learning it again though. I'm glad that I'm
yeah,
learning it again because you need to. I feel like you
yeah.
need to.
So maybe next week we'll share our topic discussions on here and we'll do like 15 minutes each and we'll both learn something from each other, hopefully.
Wow, yeah, that's a good idea. A lot of people probably are interested in topic discussions.
Yeah,
So,
I haven't done one yet and I still don't know what I'm gonna do mine on yet. I'm thinking maybe opioid use disorders and prescribing naloxone because I think there's still a lot of confusion on when and how you should prescribe it.
mhm.
So that's probably what I'm gonna do mine on.
Yeah. And then journal clubs. So those
Mhm.
are a article and journal clubs are usually pretty formal. So
Yeah.
you'll choose your article, you'll go over the study, go over all of the data, and then you'll kind of talk about your like opinions, not necessarily your opinions, but your thoughts about the study, and if you thought it was a good quality study or not. So journal clubs are also kind of difficult.
You have to read the article.
Interpreting articles is difficult for me.
Me too.
Yeah,
I'm
but it's
not
a
good at
skill you have to learn.
EBM. Yeah. And then the last project I have is a case presentation. So going over a patient case that we've seen during rotations and kind of how it follows guidelines and site protocols and kind of how we manage the patient and does it align with those guidelines.
Yeah, I don't think that I have any formal case presentations, but I do a case presentation each day, just with like they give me a couple patients and I present them in a soap note format
Wow,
to the pre.
scary. That's like literally what we got graded on
Yeah,
during
I
school.
I did that twice today. It was a stumble, but
But we'll get there.
the next one will be better. The next one will be
Yeah.
better.
I also
So
have like daily drug information questions that I present. And it's just based on like if a provider has a question.
that's cool though.
Like the one that I had yesterday was dosing conversions for estradiol for hormone replacement for transgenders.
Wow.
Yeah, which was really difficult to find like evidence because it's off-label use for most of the medication.
Hmm.
So that was a struggle.
So for like your drug information questions, like
Mm-hmm.
not that you are required to go to these WebEx meetings, but I just went to a drug information WebEx that is a student session that I'm required to go to, part of my rotation. And they told us about all of these resources. And I'm just like, I've never heard of any of these. Did
Like
you
to
know
help
that?
you?
Yeah, did you know that LexiComp has a steroid dose conversion?
No.
Yeah. It also has a birth control contraceptive conversion chart.
You're gonna have to teach us and the listeners how to get there because I was struggling because tell me why there was no compendia that had a good like conversion for like hormone replacement therapy.
Yeah, I don't know if that would have helped you, but it's just on Lexi. I think it's under the clinical tab. And I've never
Mm.
clicked on anything other than drug interactions and the search bar on LexiComp. So
Seriously.
utilize your resource.
No, yeah. I think that's a big part about learning during these rotations is how to utilize your resources and where to find this information because truthfully, not all of us can remember all the information we learned during the 4 years. And what
Exactly.
people are really looking for is that you know how to use your resources and look up answers and acknowledge that you don't know something.
But
Yeah.
we are approaching time. And next week, Kira says that we'll be giving you a case presentation. Oh, no, a topic discussion.
Topic discussion next week.
Yes. Mine will be a very brief 5 minute review of transplant immunology. I will not be
Oh,
doing
five
anything and
minutes.
nothing more in depth. And then maybe we'll talk about something else after that.
Yeah. You know, our lives just been crazy, so this is just a 30-minute chat for us.
Exactly. Yeah, but thank you for tuning in and bearing with us as we just get started. Our Me and Kira are receiving merch this in the next couple weeks. So if anybody is interested in getting merch, please just and we'll send you some merch. But thank you for listening.
Thanks for listening. See you guys later.
Bye.
Bye.